touching people is the most amazing gift that you can have in life. And I mean touching physically and mentally and spiritually, whether it's that the patient gets better or whether the family sees them off in the way that they feel is important, or whether the baby comes into the new family. It's all of those things.
And that's why we do what we do. We're healers, and we're taking another big technological leap to help us better provide reliable and safe patient care. This leap is CPOE, which stands for Computerized Provider Order Entry, sometimes referred to as Computerized Physician Order Entry. It's a big process change because it shifts the way physicians place orders, going primarily from using paper to electronically inputting orders. It's a big cultural change because it asks physicians and clinicians to adopt a new way of working.
It is so important to do this transition to CPOE. We can't push people any farther. Physicians are already working so hard right now with so many expectations and checklists. There's only so far you can push people. We need better systems. We need better tools to help the people do their work.
CPOE will provide automated guidelines, prompts, and alerts, and physicians can customize their own electronic folders.
So now I can use the pneumonia plan or the sepsis plan or the stroke plan, and I use that as a framework. I use that as a way to make sure I'm not missing any key things. But then I can reach over here and from my bag, pull all the orders I like to use a lot and drop them in, and then I'm getting the best of both worlds. Once you've got a computer in your workflow with you as a cockpit, we're building a better cockpit for doctors, right? Then we can do some very exciting things. This is a checklist, much like pilots use, to make sure you just haven't forgotten the important things, and the rest is up to you. The rest is up to you to help treat that patient.
I think there's no question, particularly in the ER, the operating room, different procedures that you do, having a checklist is the way to go. Much as we dislike it, we need to be more like pilots and still be able to practice medicine, because medicine isn't a cookbook. So I don't think that you can standardize medicine, but I think you can standardize the procedures, the medical records, the lab sets, the order sheets that would be beneficial to patients. And I think that's what we're all here for. You have to convince me that it's going to benefit the patient. If it does, I should be doing it, whether I like it or not.
No one expects a lot of our physicians to be computer gurus. The key test is, can you use the tool well just to get through your daily workflow?
With CPOE, there'll be less time wasted looking for paper charts and fewer delays in delivery of care.
Cindy, have you seen Mrs. Brown's chart?
I think Dr. Wedderburn has it.
Dr. Wedderburn, I need Mrs. Brown's chart. Dr. Morrison needs to write some orders on it.
Okay, I'm going to need it after I do rounds, and I've got more orders to write, so make sure I get it back, okay?
Okay, that's great.
CPOE enables timely care. Physicians input their patient orders into the computer, which are then sent electronically, directly to each department.
If I'm a lab tech, or I'm a phlebotomist, or I'm a pharmacist, the ability to cut out steps in my process and have things happen more quickly and to get care delivered to the patient without a lot of extra processes and extra paper and callbacks, that's a real benefit to me. Things just happen more quickly and you're able to focus on caring for the patient. We had one physician who was pretty concerned about the CPOE transition. He was caught completely by surprise because he was writing his orders for the patient and he hadn't even finished, and the x-ray tech was rolling past with the portable chest x-ray because they'd already received that order earlier in his queue and they were acting upon it, and he wasn't even done yet. And so he said for him that was the moment. He said, okay, now I see what the benefit is.
And CPOE offers other advantages.
Remote access is one of the most popular features of CPOE for our physicians, because now they can write orders from home, they can check labs from home, they can look at the progress notes from home.
Thoughtful human interaction among clinicians has always been the foundation of patient-centered care. That won't change with CPOE. In fact, now it will be even more important.
One of the other issues is the communication between the nurses and physicians. And in the new realm, that the physicians and the nurses are still going to talk, that we're not going to just expect that the physicians are going to put the orders in and the nurses are going to, not talk with the physicians.
With CPOE, there will be a learning curve, but physicians embrace new technology when it's shown to benefit the patient.
Learning initially, you will be slower because it's a new process. But over time, you learn how to leverage the tools. We're good with tools, we're good with technology as physicians, we're trained that way. The introduction of the CAT scanner. The X-ray was invented, and the CAT scan was a big leap in diagnostic capability. And yet we made that leap and made it quickly. So I think that technology per se, physicians have a very solid track record of adopting it quickly when we can see the value. And I think that's the test for CPOE.
The ingredients in quality are defined as the acronym STEEP. S-T-E-E-E-P. Healthcare delivery should be safe, should be timely, should be equitable, should be efficient, should be effective, and most of all, it should be patient-centered.
It's a clinical project. It's run by physicians, run by pharmacists, run by nurses who are really trying to do the right thing.